Top 10 things dental offices around the world are doing to open up during the pandemic. As dental offices begin to reopen around the world, dental professionals are finding new ways on how to make it safe for reopening their offices. As dental professionals, we deal with an enormous amount of aerosols, which seems to be the greatest form of transmission of the COVID-19 virus. Therefore, implementing a few things into our practice is key. The following are the top 10 things that have been implemented around the globe in order to keep dental professionals and patients safe. Number 1. Touchless temperature checks. Healthcare personnel are now monitoring patients' temperature, symptoms, and relevant epidemiological history prior to treatment. Dental staff temperature checks are also being recorded and monitored prior to commencing their shifts and at the end of their shift in order to monitor for any signs of possible infection. Number 2. N95 respirators. N95 respirators are highly recommended and being used during treatment in order to avoid inhalation of viral particles, and face fitting has been made mandatory in order to avoid inhalation of aerosolized viral particles. Number 3. Use of rubber dam. The use of a rubber dam covering the mouth and nose along with surgical aspiration is also now being used as it may limit aerosol diffusion. Number 4. Preoperative antimicrobial mouth rinse. It has been suggested that the patient should perform a 1-minute mouth rinse with 0.2% to 1% povidone iodine or 1% hydrogen peroxide prior to the dental procedure due to its virucidal activity. Number 5. Clothing protection. Long-sleeve, water-resistant disposable gowns, booties, and use of disposable hair caps have also been implemented in order to minimize cross-contamination and exposure of aerosolized viral particles on clinicians' clothing. Number 6. Proper eye protection. Eye protection has been used for years, but it should be guaranteed with the use of protective safety glasses and face shields. Many countries around the world are now also recommending that protective eyewear should undergo through disinfection with 70% isopropyl after each procedure. Number 7. High volume suction. The use of a high volume suction for all dental procedures is now being used in order to minimize aerosol production, and many are using the four-handed clinician method in order to contain the aerosol. Number 8. Avoid ultrasonic use. Many are now reducing the use of handpieces to lower aerosol or droplet production, and instead are using handpieces with anti-retractive or anti-reflux valves. Number 9. Limiting intraoral radiographs. Many are opting to perform extraoral radiographs instead of using intraoral radiographs in order to reduce the risk of saliva stimulation and coughing during the procedure. Number 10. Air ventilation systems. Although the reduction of aerosol generation has been listed among the preventive measures against COVID-19 infection, many dental professionals around the world are recommending to frequently renew indoor air either by opening the windows or using a mechanical ventilation system in between patients. But now, the real question here is, will these guidelines help us stop the spread, give our patients the best quality of work, and most important of all, keep us and our staff safe? What are your thoughts? Do you believe we should be adding something else to our guidelines? Comment on the link below and let us know what you have implemented.